All right, again, good afternoon, everyone, and welcome to the annual training, annual cost reporting portion of the annual training this afternoon. My name's Olga Genshin. I'm with the department. I'm the School Health Services Administrator. And we also have from PCG today, John Ward, Rose Jensen, and Lori Bob. From the Colorado Department of Education, we have Omar Estrada. And in addition to myself from the department, we have Tracy Gonzalez. Thanks everyone for being here today. We appreciate all the participants from across the state participating in this annual training. And I think I have gone over all of the housekeeping items, so I will go ahead and hand it over to John. Thanks, John.
Perfect. Thanks, Olga. So today we'll be going over the annual cost reporting side of the program. So here we have today's agenda. We'll go through a couple more slides of just an introduction, and then I'll take us through the annual cost reporting process and just some friendly reminders and some items that have gone on over the last year or so. I'll also be going through a quick claiming system demonstration of the annual cost report page and cost settlement page. And then we will wrap up with some important program resources and contacts. So we always like to provide a few slides of acronyms. So I won't go through any of them right now, but just know that if you do review the presentation at a later date, that these acronyms are listed out, fully spelled out as well. And I will do my very best to not say an acronym and just say the full name of each acronym throughout the presentation. But as we go through, feel free to use that chat box if I do miss one, or again, in general, if you have a question, and we will stop and answer those questions. So you may have heard us in the past always talk about how this program is both federally and state funded. So we did want to briefly go over kind of the different agencies that make up the SHS program. I won't go into full detail, just a brief overview. If you would like kind of a full detail explanation of the next 2 or 3 slides, highly recommend reviewing or rewatching the RMTS session that was recorded this morning. Rose went through kind of in detail each of the different kind of items and responsibilities of each kind of governing body. But in general, left-hand side, you have the federal government. So that would be CMS, or Centers for Medicare and Medicaid Services. So that is going to be the agency that obviously passes down all the federal regulations and rules that these types of programs, such as the SHS program, must follow and kind of operate by. Next, you have the state agency, which in this case would be the department. So they're going to administer the program, host trainings, as well as typically hire a vendor to help facilitate and administer the program also. And then also, obviously, this program would not be kind of up and running without you, the districts, as well. So you all are kind of completing the various requirements to receive the reimbursement that you do. So again, this program would not be up and running without you all either. So after that general review, kind of just going into a little bit more detail specifically for this program. So again, that state agency is going to be the Department of Healthcare Policy and Financing, also referred to as the department. So they are the program policy expert. They again administer trainings. They're going to be the ultimate decider of any cost report extensions or any other extensions as well, and also enforcing the CMS guidelines, which is that federal body that passes down those rules and guidance. Next, you have Public Consulting Group, which is myself. I'm part of PCG. So we are the state's vendor, or the department's vendor, and our purpose and goal is to help administer the program by providing kind of the technology, for districts to report their costs, complete the random moment time study, and that's via the PCG claiming system. We also host a help desk where districts can reach out to us via phone or email also. So you may have also kind of heard us explain kind of the difference between CDE and PCG in the past by saying PCG and the department help the districts receive the reimbursement. CDE, or the Colorado Department of Education, help you spend that reimbursement, and that is through the reimbursement spending report as well as the local services plan, or LSP. So Colorado Department of Education, that's one of their many duties and expertise within this program of helping kind of keep the reimbursement amounts for each district towards the health and services of students within each district. Next, and then finally, we have the stakeholders. So stakeholders are typically our more experienced folks within the program. So these kind of are broken up into region. There is a map that displays where all of the stakeholders are located, and within each stakeholders region, there are individual districts. So stakeholders offer themselves up to be a mentor to those individual districts, and they also pass along any feedback during our stakeholder meetings as well. So for instance, one thing that came about during our last stakeholder meeting was just renaming what used to be the strategic intervention trainings, which are part of the comprehensive reviews. So through, again, district feedback that was passed along by the stakeholders, that name was changed to the program compliance training. So can be a little feedback like that, or more kind of specific topics that impact more parts of the program that can be passed along to stakeholders. All right, so I won't go through this slide. We kind of went through everything here, but did want to mention another kind of part or agency of the program are billers. So they help. It is optional if you would like to contract with a biller, but they do help you bill Medicaid or Health First Colorado for those direct services that your providers provide throughout the year. So they are definitely an important part of the program as well. Okay, so just going to check to see if we have any questions, and not seeing any. So let's go through the annual cost reporting process. So we wanted to, again, show this trend graph related to annual reimbursement. We always show this graph each and every year, but it's especially important this year round due to kind of that decrease that you see for FY21. And just a note about this is aside from your 4 quarterly cost reports. This is just the statewide annual reimbursement numbers. So wanted to, again, just touch base regarding that decrease. Our first little dip here, not little dip, but dip in general over the course of really the lifespan of the program. So wanted to touch on that. Large part of that, again, was the pandemic, obviously. Probably the hardest hit areas that we saw on the FY21 cost report was obviously transportation. So while districts were in a virtual setting, and even after that, towards kind of later on in the pandemic, switching back and forth between a virtual and on-site setting, obviously transportation was impacted. Students weren't being transported. Really, maybe just a little bit of maintenance and repairs were being reported for the vehicle fleet or bus fleet. So we saw that with transportation, and we also, one of the most common topics that we were hearing from districts, even to this day, is staff turnover. So we did see a decrease in direct medical payroll, as well as direct medical other costs, just with kind of decreased budgets as well. So just wanted to touch base on FY21 a little bit, and then later on, we'll kind of talk through PCG's and the department's outlook for FY22 and kind of what we are hoping and expecting for the FY22 annual cost settlement. But one of the other things that occurred a few months ago was if you did report direct medical other costs, you did have to complete some additional actions. FY21 again was the first annual cost report that districts saw free care reimbursement on. So again, that was the first year of free care reimbursement. With that, we did look at the calculation and kind of how it was drafted initially, and decided that it would be best to move direct medical other costs or materials and supplies from just prior to the IEP ratio or MER ratio to just before the unrestricted indirect cost rate. And I will show that in the claiming system a little bit later on, as well as some graphics on the next slide. But just that was the main reason for the calculation. If you talked to me during that period, you heard me say that past years prior to FY21 were fine. Again, that was because this really just had to do with free care and that calculation. So because we were already making adjustments in the claiming system as well as in policy documents, and typically the direct medical calculation matches the general structure of free care, we decided to make that same change with the direct medical calculation also. So that aside, again, I'll go through that in detail on the next slide, as well as, or in a couple slides, as well as in the claiming system. But this slide is more of just a massive thank you again to those districts who had to reapprove their cost settlement and re-sign their CPE form. You all did it in a very, very tight time frame with the goal of the department being able to send out those payments on time. So again, this is really just a massive thank you to you all. So on this topic of direct medical other costs or materials and supplies, I just wanted to go through just a couple reminders as you're completing your FY22 annual cost report. Just like with anything on any of the cost reports, no individual item should be 100% federally funded. It is okay if it's partially federally funded, but with 100% federally funded items, you're not going to receive any reimbursement for that line item. So those items should not be reported. If you're ever on the fence of whether a item or material or supply is allowable on the annual cost report, always ask yourself these three questions down in the bottom right. Number one, is the item used for a direct medical purpose? So ensuring that it's not administrative in nature. And then 2 and 3 kind of go together, but is the item used in a direct medical service prescribed in the student's IEP or other plan of care? So ensuring that item is being used to achieve those direct medical goals in that student's plan of care. Again, making sure it's not educational in nature, not administrative in nature, are the key things. So as you're doing your cost report, if you do have any questions on any items, always feel free to give us a call and we can walk through how the item is being used and whether it would be allowable on the annual cost report. Okay, so this is kind of the graphic version of the claiming system and the calculation change. So again, we'll go through it in the claiming system also, but just wanted to provide kind of a graphic as well of the different kind of 3 different areas of Medicaid allowable costs. So with this, step 1 is going to be the payroll amounts. So under direct service, you have salary, benefits, and contracted staff costs for your direct service staff. That second item, which is materials, supplies, and other allowable costs, that is the item that was moved in the calculation for both free care and direct service. So with that, for direct service, it used to be just before the IEP ratio, but now you can see it's just before the unrestricted indirect cost rate. Step 3 is applying that unrestricted indirect cost rate. We'll then multiply the result of that by the direct medical time study percentage, which is that statewide average. And then we'll also apply the IEP ratio, and that would get you to your direct medical allowable costs. Moving down to free care, one key reminder, steps 1 through 3 are going to be the exact same amounts. So free care in the claiming system and just in the calculation in general are going to use the same amounts you list for direct service costs. So payroll costs and contracted costs will equal what's listed under direct service. Same thing with materials and supplies. You can always add in materials and supplies related to free care. It's just going to be in that same field that you would report direct medical materials and supplies as well. Same unrestricted indirect cost rate is applied, which is that added boost to your costs. So that's going to increase the amounts or that total from steps 1 and 2. And then the next 2 steps are what is the difference between direct medical and free care. Instead of the direct medical time study percentage, it's the free care portion of the time study percentage, still the statewide average, but again, the free care portion of it. And then instead of the IEP ratio, we have the MER ratio, and that would get you to your free care allowable costs. In the case of transportation, if your district does report transportation, very similar general calculation as the 2 first lines with direct service and free care. We'll add in, we'll total all the payroll costs, so salary, benefits, and contracted staff costs. We'll add in the transportation other costs, or items that strictly make the bus go. We'll add in depreciation for all those vehicles for that year. And then that same unrestricted indirect costs percentage is applied. So that's increasing the total from step 1 and 2. And then the next 2 ratios depend on how you report transportation. So if you report only specialized transportation, you'll have that one-way trips ratio applied only. If you report not only specialized transportation, you'll have the one-way trips ratio applied, as well as the transportation students IEP services ratio also. And that would get you to your transportation allowable costs. So this kind of mirrors the calculation from the cost report page. This next slide goes through the cost settlement and CPE form page. So with this, step 1 is going to be totaling up all 3 areas of allowable Medicaid allowable costs. So direct medical, free care, and transportation. So those all are totaled. We'll subtract the gross interim payments for that district. We'll apply the federal medical assistance percentage, or FMAP for short, essentially how much the federal government's willing to reimburse of those costs. Always has to be at least 50%, but can vary year to year. And lastly, we'll subtract out the state withhold, which is 2.5%, and that resulting number will be what is owed to that district or their cost settlement. So don't see any questions yet, so I'll keep going along. So as we kind of enter a new program fiscal year, wanted to kind of lay out all the different actions that you all are taking in terms of cost reports and participating in RMTS, as well as the various staff pool lists. So in any given quarter, what this graphic is really talking about is kind of displaying that how much you are dealing with different fiscal years within any given quarter. So kind of the purple color that's first listed under July through September 2022. Those are going to be items related to previous fiscal years. And then you have the blue, which is going to be for the current fiscal year. And then kind of the one lone teal item in the bottom right is going to be for a future fiscal year. So we'll go through a couple here. A lot of it's going to be the same throughout the various quarters, but first up under JS22, we have reporting your AJ22 quarterly costs. So it's filling out that cost report. So everyone should have that certified by now. And then we have the FY22 annual cost report, which was opened up on August 1st and is due on November 1st. And then we're moving into items for the current fiscal year. So you have completing your October through December staff list and calendar. And then all throughout every single month of the fiscal year, you're receiving those monthly interim payments. So once the cost report, annual cost report is certified in November or by November, you'll complete your FY22 desk review. So that occurs at the very, very latest in November of 2022 this year. And then once that desk review is completed, and if you are selected for a comprehensive review, you'll be participating in that process as well. So moving into the current fiscal year, you have participating again in the RMTS, or the random moment time study. So answering those random moment in time surveys, completing the July through September 2022 quarterly cost report, and then kind of prepping for the next quarter, which is your staff list and calendar for January through March. Moving on to January through March of 2023, you'll be again wrapping up the comprehensive review. If you are selected, we typically have those completed by mid-January. And then continuing to participate in the RMTS, and then reporting your October through December 2022 quarterly costs on the MAC report. And then again, prepping for the next quarter with your staff list and calendar. By the middle of May of each year, you should receive your FY22 annual cost settlement. Typically occurs in the middle of May of each year, but no later than June 30th. Continuing to participate in the random moment time study, you have your quarterly cost report for the previous quarter. So that would be for January through March. Still receiving your monthly interim payments. And then by middle of April of each year, you should receive your interim rate letter, which will detail out what the department and PCG recommend your monthly interim payments be for that next fiscal year, which will be 2024. So just wanted, again, to acknowledge that everyone is working with different fiscal years in any given quarter. And with this, organization is key, obviously. If you're new to the program and have any questions on how best to really handle everything with the different fiscal years and at any given moment, definitely recommend reaching out to your stakeholders and really starting these items as soon as possible. For instance, the annual cost report, I hope that everyone has at least taken a look at that, just so they can start prepping the documentation needed to fill that cost report out. So I'm still not seeing any questions, so we'll go through the claiming system. So let me see. Perfect. All right, so this is the cost report page. This is just mock data or dummy data, so don't pay attention to the numbers, just focus on the columns. But this would be the annual dropdown and then cost report. So we'll be going through FY21 here. This first table you will see on your cost report page remains the same. It's just a summary of all the payroll costs that you entered on that cost report. So salary, benefits, contracted staff costs, as well as federal funds. So always remember to utilize this column or this field if you have any federal funds or non-allowable costs to enter. One key thing to note is you can expand these various service types to show the job categories. So if I just clicked under nursing here, we have health techs as well as RNs, and you can see number of staff for each, as well as the individual payroll amounts also. So again, that's just a summary of everything that you entered. And this is the direct medical allowable cost calculation. So you can see up here, our total net payroll cost was just over 18 million. Again, it's just fake data, mock data. That gets brought down to here. So this is our net staff costs. This is, again, the item that was moved up in the calculation. Direct medical other costs used to be just before the IEP ratio. Those are those materials and supplies used in the provision of a direct medical service. We'll subtract out any federal funds, which this district did not have any, to reach our total. We'll next apply the unrestricted indirect cost rate. The indirect cost column is just the result of that. So key thing to note here, you'll see 299 and then 60,000 in indirect costs, and then those two get added together. So that is, again, that added boost to steps 1 and 2, if you refer back to that graphic. So those indirect costs are added in, and next we're going to apply the direct medical time study percentage, that's statewide average, and then also apply the IEP ratio. And that gets us to our direct medical allowable costs on the far right-hand side. Next, very similar, and let me scroll down a little bit, perfect. So not scrolling all the way down because I do want to show this. So you'll see 18 million in terms of payroll costs for direct medical. Again, those same costs are going to be used in the free care calculation. So steps 1, 2, and then also if I go to the far right, steps 3, the unrestricted indirect cost rate, are going to be the same as direct medical. So the same payroll costs, same direct medical other costs or materials and supplies to reach the same total. One key note to keep in mind for FY22, this staff allocation factor. So this was set to 75% last year because free care started in October through December. So we had to account for free care not being a part of July through September, because again, it started in October through December. So this was set to 75%. On your FY22 annual cost report, you'll still see this column. It'll just be set to 100% because all free care costs are going to be obviously included for the 2021 to 2022 year. So that will be set to 100% on the cost report that you're currently completing. Then same indirect cost rate is applied. So adding in those indirect costs to get to the staff costs plus indirect costs. And then instead of applying the direct medical free care or direct medical time study percentage, we'll apply the free care time study percentage, still the statewide average, just that free care portion of those surveys. And then instead of the IEP ratio, we'll apply the MER ratio or MER. And that gets us to our free care allowable costs on the far right-hand side. Transportation remains unchanged from past years, very similar to direct medical. This table right here is just a summary of everything you entered. So salary, benefits, as well as federal funds also. So the total net staff costs get brought down to this summary table down below. We'll add in any other costs, so fuel and oil, maintenance and repairs, insurance, wheels and tires, things like that, to get to our total transportation costs. We'll apply that same unrestricted indirect cost rate as direct medical and free care. We'll add those costs in to get to, again, net direct cost plus indirect costs. And if you report only specialized transportation, you'll just have this one-way trips ratio applied. One key reminder, if you do report only specialized transportation, you'll still see the second transportation ratio applied. It'll just be set to 100%, so it doesn't impact your costs. But if you do report not only specialized transportation, you'll have both of these ratios applied, and this percentage that you report both the numerator and denominator of obviously should not equal 100%. So that gets you to your transportation Medicaid allowable costs. So with these pages, everything flows top to bottom, including the various pages. So next page of the cost report is the cost settlement page. So this is very similar to your CPE form page, aside from the CPE form has that signature portion down at the bottom. So first up is step one, which is your certified public expenditures. Same thing as Medicaid allowable costs. So this is including all of our resulting calculations on, and I did not mean to click that, all the resulting calculations on the cost for page. So these items are added up to get to our total CPE costs or direct Medicaid allowable costs up here. Next, we'll subtract out the gross interim payments. And that is the result for step 3. And then step 4 is just applying the federal medical assistance percentage, again, or FMAP for short. It's very similar to that staff allocation factor. If you look back at your FY21 cost settlement page or CPE form, you would have noticed that July through September was different than the remaining 3 quarters. Again, that was just because free care did not start until October. So free care was broken up between the last 3 quarters and excluded from July through September on your CPE form page. Step 5 is just subtracting out the state withhold, which again is 2.5%. So that will be subtracted out. And this last amount is what is owed to the district, so 291. And in most of these calculations, you can kind of see in these parentheses what exactly math-wise is going on. So subtracting the state withhold from the result of applying the FMAPs to get to this final total here. And I'm not seeing any questions, so I'm going to go back to our PowerPoint. All right, so we've talked about FY21, and we're, just like I said in the very, very beginning, going to kind of talk about our PCGs and the department's hopeful outlook for FY22. So for FY21, key reminders, the free care RMTS results were 3.97%. The preliminary FY22 free care RMTS percentage is preliminary again, 5.07%, which is about a 1.1% increase from FY21. So you can see this graph, you saw the same graph if you attended the RMTS session earlier, but kind of goes into our perspective for FY22. So we're not really expecting a full recovery back to where we were with FY20 at that 55 million, but maybe close to halfway there. So baby steps over the next few years to get us back to where we again were pre-pandemic. And there's multiple things of why we are thinking that. So with FY21, key thing to remember is free care in terms of reimbursement brought in 2.8 million statewide. So again, going back to if I flip back here really quick, that FY21 number of 52.5 million could have been a whole lot worse without free care. So even though we unknowingly, because COVID and the pandemic wasn't a thing when we scheduled the rollout for free care, we were obviously could not predict the future, but even though it was rolled out during a pandemic, definitely helped mitigate it on the annual reimbursement side. So also keep in mind for FY22, that free care didn't start until October of 2020. So during FY21, everyone went a full quarter without free care because it wasn't implemented yet. FY22, and if you think about that staff allocation factor that we went through, it's going to be a full year of free care costs being included in the annual cost settlement calculation. So keep that in mind. We also have the potential 1.1% increase in that free care time study percentage. So that is slowly increasing as well. And in general, districts are largely back in person, not in a virtual setting. So hopefully transportation starts to increase a bit for the FY22 annual cost report. We talked about earlier in earlier sessions that the Medicaid enrollment was not terminated during the public health emergency. And then lastly, with your FY22 interim payments. So this is kind of thinking a while back of when you received that rate letter or interim rate letter. We did take some precautions with your FY22 monthly interim payments also. We used, instead of using the typical statewide average for the direct medical time study percentage, we used the October through December 2020 percentage, which was a few percentage points lower. And then we also took a full percentage point off of the free care time study percentage also. So couple kind of mitigation strategies that were put in place with those monthly interim payments. Again, just at the time, we could not predict how long, obviously, the pandemic was going to last, how long districts are going to be in a virtual setting and all of that. So if all goes, I mean, if really the best case scenario is costs, the reported costs increase with FY22 with transportation, and it's kind of the inverse of what the department and PCG tend to do. One of the goals of the interim rate setting is to get districts more money during the year and receive less of a cost settlement at the very end of the year in May. So more money during the year at that time and receiving less of a lump sum at the end of the year. So kind of the inverse of that could happen with FY22. Y'all could just have received less money during the year in terms of monthly interim payments and just receive a larger amount come May. So that, I mean, is the hopeful situation if kind of reported costs go back to or are close back to where they were on the cost report. Could just be the inverse of what kind of typically happens. All right, so tips for successful annual cost reporting. So certify your cost report as soon as possible. No need to certify it within the first 3 weeks or anything. Definitely take your time, begin pulling the information and documentation now and as you go. You don't have to certify, even if you completely fill out the cost report, you don't have to certify it right away. You can take a couple weeks to review. But the cost report does have to be certified by November 1st. So the sooner you complete your cost report, sooner you receive your desk review. And if you are selected for a comprehensive review, sooner you can start that process also. But just as always, if you certify your cost report, say in October, and it's October 13th or something, and you need to have it reopened to make any additional adjustments, just let us know and we'll reopen it. Just that November 1st due date still remains in effect. So with a note about the desk review, it's always good to keep that documentation on hand that you use to fill out your annual cost report, just in case any of the questions within the desk review just require you to re-review a piece of documentation. You have it on there or have it nearby to quickly answer or whatever question is in the desk review. And lastly, only report costs for participants according to time on the staff list. So always keep in mind that the annual cost report is based off dates of service. So the pay you are reporting must be related to direct services provided while on the direct service staff list. So keep that in mind as well. All right, so here we just have some important dates. Again, the annual cost report for FY22 opened up on August 1st and is due on November 1st. One key reminder I forgot to say on the last slide is just feedback I've received from districts over the last few years. Highly recommend if you are reporting transportation, having your transportation department started as soon as possible and getting you those payroll costs, transportation, other costs, things like that. It's always highly recommended and best practice to really get them started as soon as possible. Desk reviews are done on a rolling basis, meaning a few days after you certify your annual cost report, you should receive your desk review. And we try to wrap those up for all districts by November 8th, or a week after the cost report is due. And then cost settlement, you should receive that notification no later than June 30th, but typically in the middle of May is when typically those notifications go out. Okay, so I was slightly tricked during in-person trainings because if you have the PowerPoint printed out or on your screen, it does contain the answers to some of the questions I'm going to ask you on the following slides. So if you would like to play along, please put those printouts away or close that PDF document. And please put your answers in the chat box, the Zoom chat box. We just have 4 quick questions to just kind of checks for understanding and make sure everyone has been listening. So first question, do you report costs on your annual cost report based on date of service or date of payment? And this is a true test of if you were listening, because I just said this probably 20 seconds ago. Okay, so we have Marley, dates of service, Tracy, date of service. Okay, so yeah, they are coming in quick now. So yeah, correct answer is dates of service. So always remember to kind of switch your thinking. I know you just completed your AJ quarterly cost report, which is date of payment. Just remember to kind of switch that thinking to dates of service. Also keep in mind any summer pay. So if you have providers who work over 10 months but are paid over 12 months, always ensure to include those 2 extra months as well in your reported payroll costs. Again, as long as they were on the staff pull list. Retention pay, if your district is still doing COVID bonuses or anything like that, ensure to include that on your cost report as well. All right, second question. Can you report direct medical other costs for items required for the provision of a direct medical service for students that have a other plan of care? So this is solely a other plan of care, not attached to an IEP. Just a standalone other plan of care. Okay, so we got yes by Tracy, we got a few no's. Okay, Kelly says yes. Okay, so the answer is yes. So you heard me talk about earlier of where to report these costs. It's going to be in the same field under the annual dropdown and direct medical other costs. And by other, a standalone other plan of care, we're talking about free care. So materials and supplies used in the provision of a direct medical service as it's prescribed in a student's other plan of care can also be reported. Just keep in mind everything. Items that we went over a few slides ago cannot be federally funded, 100% federally funded. It's fine if they're partially federally funded, but also keep in mind with free care, materials and supplies, you can report those things as well. All right, so question number 3, how do you report costs for free care providers? And then while folks are thinking about that, yeah, to your question, John, it depends on how COVID bonuses were sourced. If they were 100% federal funds or ESSER funds, you would have to obviously not include that or report that in the federal funds non allowable cost field. But I have heard of just, yes, obviously very few districts, but those funds not being federally sourced also for those bonuses. So again, how do you report costs for free care providers? And it goes back to the graphic that we walked through, as well as the claiming system. So how do you enter payroll costs related to free care, materials and supplies related to free care? Okay, not getting any answers. Does anybody want to just take a chance and put an answer in the chat? Okay, give a couple seconds. Okay. So again, with free care calculation, it's going to be the same cost that you enter for direct medical. So the cost that you enter for direct service providers will be used for both direct medical costs as well as free care. So again, all those payroll costs you enter for the providers on your direct service staff pool list, those are going to be automatically brought down by the PCG claiming system to that free care line as well. So that's why I say with the previous question, with other costs related to free care and students solely on another plan of care, make sure you report those as well. Same rules apply. Must be items used in the provision of a direct medical service, can't be administrative or educational in nature. Same rules apply, just kind of again opens up the which students, which materials or supplies for students can be included. So if you, again, just with anything with the cost report, if you have questions on a specific item, or maybe after this training, you want to be walked through again the cost report page and how everything is being populated, never hesitate to give us a call and we can set up a meeting with you to kind of share our screen and go through everything. All right, last question. I expect a lot of answers in the chat with this one. Coordinators should wait until the very last minute to enter, verify, and certify their annual cost reports. Thank you, Tracy, for the exclamation point. All right, yeah, the correct answer is no. We had folks teasing me in person saying yes, but it is false. No need to complete it and certify it within the first couple of weeks. Definitely take your time. Again, no need to certify it immediately after you populate everything. You can take your time to review it. If it's before the due date of November 1st and you need to make an adjustment, you can also request that your annual cost report be reopened. You can also do that during the desk review process as well. Desk review process isn't all about just removing costs. If you notice something that was not reported, or maybe in the kind of extreme circumstances, a zero was left off or something, again, just let us know and we'll reopen that cost report for you. Okay, so lastly, program resources. You have the SHS program website, the link to the PCG claiming system, as well as a wealth of resources that are always available to you all. So you have the program manual, which is kind of your A to Z document related to everything about the program. So that's a good, always a good document to refer to if you have a specific question. Program calendar, highly recommend to have that printed out or just saved to your desktop. That will include all the important dates in terms of cost report openings, staff list openings, when you're set to receive your monthly interim payments each and every month. Really a good document to have on hand throughout the year. You also have quarterly refresher trainings, which are kind of the more in-depth recorded trainings. I think each one is about 30 minutes to 45 minutes, but it covers, each one individual video covers anything from the annual cost reporting side of things to the quarterly cost reporting side of things. RMTS and compliance. So those are available to you, as well as the program compliance trainings. Even if you're not selected for a comprehensive review, you can always click in that document and watch, I think each one's a quick 10-minute video on a specific topic. So even if you're not selected for a review, you can always watch those videos whenever you want to during the year. And then lastly, you have our contact information, Olga at the department, Omar at the CDE, as well as the various phone numbers and email addresses for PCG. Last note that I'll make before I pass it off to Olga is you may have noticed on the claiming system pages a blue bubble. I believe it says help or contact. And if you click that bubble, it'll pull up a form that you fill out. That's essentially an email to PCG. So if you don't want to remember our email addresses, you can contact us via that little option on the claiming system now too. But last chance for any questions before I pass it off to Olga. Okay, I will pass off to you, Olga.
Okay, thank you, everyone, and thank you, John. We will just sit tight here for just a few more minutes to make sure that we've answered all your questions. Otherwise, if you've signed up for our 2:30 program compliance training, we will see you then, and that will be our last virtual session of the day. We'll sit tight as everyone exits a call just to make sure that we've addressed everything. And thanks again for attending, everyone.